All right, today we're jumping into a really critical medical condition, diabetic ketoacidosis, or as you'll hear it called, DKA. This is a big one, so let's get right to it. So first things first, let's be absolutely clear. DKA is not some minor issue. It is a full-blown, life-threatening emergency that needs immediate medical attention. Understanding that urgency is step one. So what is it, technically? Well, the textbook definition calls it a hyperglycemic emergency. That's just a way of saying blood sugar levels are dangerously high. And it's something we see mostly in people with type 1 diabetes. So what on earth triggers a crisis like this? You know, the entire dangerous cascade of DKA all starts from one single critical breakdown in how the body works. Let's dig into what that single point of failure really is. And here it is. The core problem, the trigger for the whole mess, is an absolute lack of insulin. Now think of insulin like the key that unlocks your body's cells so they can take in glucose, sugar, for energy. In DKA, that key is just gone. The fuel is right there, floating around in the blood, but the cells are locked out. They're literally starving. So when that one thing fails, when there's no insulin, it sets off this crazy chain reaction. It's like a domino effect with 3 major and pretty scary consequences for the body. Okay, so here's how it all plays out. The body's cells are starving for sugar, so the body panics. It thinks, I need fuel now, and starts burning fat like crazy. This process is called ketogenesis, and it creates these byproducts called ketones. The problem is, ketones are acidic. As they build up, the blood itself turns dangerously acidic. That's metabolic acidosis. At the very same time, the body is desperately trying to get rid of all that extra sugar and all those ketones by flushing them out in the urine, which leads to massive, severe dehydration. So with all that chaos happening on the inside, what does that actually look like from the outside? How does a patient with DKA show up in the clinic or the emergency room? Well, they'll often come in with really bad abdominal pain, they'll be vomiting, and you can just see the dehydration. But then there's this very specific and honestly kind of fascinating sign, Kussmaul breathing. This isn't just regular heavy breathing. No, it's a very distinct pattern of deep, rapid breathing. And what's going on here is the body's desperate last-ditch effort to fix the acid problem. It's trying to physically blow off carbon dioxide, which is an acid, with every single breath. And here's the number that really clinches the diagnosis: a blood glucose level over 11 millimoles per liter. That number confirms the crazy high blood sugar that's driving this whole crisis. Okay, so we've got a life-threatening emergency on our hands. How do we fix it? Well, there's a very clear, very specific protocol for managing DKA and turning this situation around. Now, the order of operations here is absolutely crucial. Priority number 1 is always IV fluids. You have to rehydrate the patient first. You gotta get them stable. Only after the fluids are running do you start an IV infusion of insulin. That's when you finally give the body the key it needs to start using all that sugar. And at the same time, you're measuring arterial blood gases to get a precise read on the acid levels in the blood and track how things are improving. And while we're on the topic, the arterial blood gas, or ABG, is the gold standard for checking all of this. But it's worth knowing that a venous blood gas, a VBG, can sometimes be used as an alternative if getting that arterial sample is proving to be difficult. So we've walked through the what, the why, and the how of DKA. Now let's boil it all down to the most important, high-yield takeaways. And really, this one image tells the entire story. You've got the definition right there: a life-threatening emergency, usually in type 1 diabetes, all kicking off from a lack of insulin. You can see the classic presentation, that abdominal pain, the vomiting, and of course the Kussmaul breathing. And then the management plan, reminding us of that critical rule: fluids first, then insulin. It really is the complete picture. Which brings us to a really interesting final thought. We understand this condition pretty well, right? We know what causes it, and we have a clear, effective protocol to treat it. So why is DKA still such a common and critical medical emergency all over the world? That's definitely something to think about. Thanks for joining this explainer.